Good evening to all. So today's remedy is Baryta Carb. Nothing much from the introductory part. Just to say something about barium is that barium compounds in homeopathy usually show affections to glands. Okay, so glandular affection is very marked. Also, when you think of Baryta Carb, you have indications for children as well as old age people. Baryta Mure a little more for old people. Baryta iode is also important in glandular affections like tonsils and breast affections. Okay. You also can see inflammation with suppuration in Baryta group. So that being said, I think Baryta Mure can be thought in arteriosclerosis, high BP conditions. Okay, Baryta iode can show very marked affections on the lymphatic side and glandular parts. Coming on the lymphatic system, yeah, definitely tonsils are involved in Baryta Carb. So you have lymphoid organs, primary and secondary. Primary being your thymus, bone marrow, and all. And in secondary you have tonsils, some kind of Peyer's patches, spleen, all those comes there. So again, the usual tonsillitis that happens is usually due to inflammation of palatine tonsils. So what are the other possible tonsils that you need to remember is your something in the next slide. That's basically your nasopharyngeal tonsil, that is your adenoids, tubal tonsils, palatine tonsils, and lingual tonsils, all making a ring-like structure that is known as Valde's ring. Okay, so why this is written in material session is because I want you people to also remember a little of anatomy. Okay, nothing related to the remedy again. Quick revision: 5 points on tonsils. Basically, it's situated in the oropharyngeal portion. Now, pharynx has 3 divisions: nasopharynx, oropharynx, as well as laryngopharynx, and this palatine tonsil is a feature of oropharynx. Okay, comes from second pharyngeal pouch. The main arterial supply is a tonsillar branch of facial artery. So something that can come as a twisted thing. So you don't expect facial artery as the main supply for tonsils. You tend to click as tonsillar artery, but where it is coming? It is coming from facial artery. Usually it's a viral disease, but if it's bacterial, then you need to always go for a streptococcus screening. Okay. Constitution, you have adapted to first and second childhood, soric or tubercular. Okay, so that shows how the remedy is. Can be soric child or a tubercular child. Patient subject to quinsy. So what is quinsy? Quinsy is peritonsillar abscess. So again showing the suppurative tendency of this remedy. Takes cold easily. Even the least cold precipitates an attack of tonsillitis. Now from tonsillitis it can go to quinsy. So quinsy is usually a complication of untreated or poorly managed tonsillitis. Very rare. It's not very common situation, but once it occurs, it's pretty difficult to manage. Like it carries a high kind of what to say, it troubles the patient a lot because of the pain, the fever, the features like speech difficulties are there, like hot potato voice and all. So leave it aside. So basically you have this suppurative tendency running in the remedy. We already said the glandular affections, so it is scrofulous in nature. Dwarfish children who do not grow. Now do not grow means something like a dwarfism. So what type of dwarfism can happen in this child can be understood from the next point, children both physically and mentally weak. So in dwarfism, you can think of a issue with growth hormone deficiency, or it can be due to thyroid hormone deficiency. Now, growth hormone deficiency can usually show physical dwarfism but not mental dwarfism. But in this case, it's a little more for a thyroid deficiency, basically or cretinism. Now, cretinism shows poor IQ as well as short stature. So that's why I think this should be a little more adapted to hypothyroidism kind of cases. Okay. That being said, I think dwarfish historical women and old maids with scanty menses, deficient heat, so basically your chilly nature of Baryta comes out with this point. Okay. All cachectic people, scrofulous, especially when fat, or those who suffer from gouty complaints. Disease of old men, very important. Disease of old men, hypertrophy or induration of prostate and testis. Mental and physical weakness, apoplectic tendency in old people, complaints of old drunkards, headache of aged people who are childish. Okay, so you have induration of prostate and all happening of old men, as well as stroke-like complaints and complaints of old drunkards. Okay, headache. Mental generals, now if the development is poor, you don't expect the child to remember so much. So that's how you can correlate. So memory is poor. If you are thinking of an old age person, still the memory is poor. Okay. Speaking of the child is inattentive. So why not indicate? Why not given ADHD is a question. Okay. So it is definitely indicated in ADHD. It can be indicated in ASD kind of situations, or again hypothyroidism. Hypothyroidism in children are pretty rare to find these days because of the guidelines for neonatal care. But still, if at all there is some kind of factor that precipitated hypothyroidism in a child, definitely this is one of the leading remedies to be thought. Okay, child cannot be taught for its poor memory because it cannot remember, and there is threatened idiocy. Now, chronic idiocy is Baryta Carb. Acute idiocy, you need to remember it is helleborus, and also idiocy can be seen in Ithusa. Some comparisons for deficient memory. Even forgets his own name, cannot spell it correctly. It's your metronome. Okay, very important. Sudden loss of memory, unfit for business. Everything seems to be in a dream. It's your anacardium. Forgets his last word, begins a sentence, but forgets what he intends to speak. So that is cannabis indica. Okay. Weakness of memory, uses wrong words, does not recognize well-known streets. Very important question. This is your nux moschata. Weakness of memory and slowness of thought. From keynotes, it is your carbo wedge. And the last very important symptom of selenium, very forgetful in business. You have two business coming here. One is for anacardium and the other for selenium. Very forgetful in business, but during sleep dreams of what he had been forgetting in the conscious time. So that's your selenium. So selenium, nux moschata, cannabis indica, as well as medrinum are very the points mentioned here are very, very important. Okay. Physical generals, you can see swelling and induration of glands. Even incipient separation of glands can be seen. Now, which glands are affected? It can be cervical glands, your neck glands, like again tonsils, even your lymphatic nodes can be affected. Inguinal nodes can be affected. Again, prostates, all these things can be affected. Offensive foot sweat, toe and soles get sore, and foot sweat of heel. Throat affections after checked foot sweat. Okay, it's throat affections after checked foot sweat. You have some comparisons like Graphitis, Sorinum, Sanicula and Cilicia. Also again we have already discussed for the sensitivity of cold. Okay, now in Sorinum you have profuse perspiration, but which actually gives amelioration. Okay, in Sanicula you have your toes show increased perspiration as if stepped in cold water, and in Cilicia it's not only the feet, that is hand, toes, feet and axilla. Okay, all places sweat. In Graphitis there is nothing much written, it's just offensive foot sweat, that's why I have not mentioned anything. In throat there is inability to swallow anything but liquids, which we have already discussed in the Baryta chapter. So can swallow only liquids, you have 3 remedies. It's basically Baryta, Baryta as well as your Cilicia. But Cilicia has a problem, even though it wants to swallow but it cannot because it has aversion. Can only swallow liquids but averse liquids is your Cilicia. Okay. Hemorrhoids protrude every time he urinates, a symptom that is also seen in muriatic acid. Okay, so Baryta and muriatic acid shows this symptom. Hemorrhoids protrude every time he urinates. In respiratory, again chronic cough in soric children, enlarged tonsils or elongated uvula. Okay, so that is something to be remembered. Okay, some patients definitely come complaining of elongated uvula, and which is why they get a very hacking kind of cough. Aggravation after slight cold, also you have alumina. From boric, I think important symptoms are mentioned. Yeah, sensation as of cobweb on face. The other remedies are alumina, borax, Graphitis. Even you can remember your ranunculus scleratus. One important remedy is ranunculus scleratus that you need to remember for cobweb sensation on the face. Okay, I think even bromium also comes in the same thing. So we have 3 B's. Okay, it is Baryta, you have borax, you have bromium, you have a G. So it's triple BG. Triple B and G. Also you have alumina. Okay, ranunculus scleratus you can remember if you want, but not very important. Alright. In modalities you have a very important symptom, that is aggravation during thinking of symptom. So if the complaint is again being thought by the patient, it is said that the complaint is aggravated. So we have a list of remedies like calcirephos, zelsemium, helonius, fedorenum, oxalic acid. These remedies show aggravation of complaint when they are thinking of their symptoms. Okay, and there is one more important modality lying on painful side, that is your aconite, arsalve, hepar, iodum, calicarb. The opposite being shown by bryonia, pulsatilla, ammonium carbonol. Alright. Relations after Baryta carb, Sorinum is often indicated so as to eradicate the constitutional tendency to quinsy. Okay. Complementary to Dulcamla, Silica and Sorinum. Again, Silica, Sorinum, Baryta, all are scrofulous remedies and suppurative remedies. Alright. Tonsils become inflamed after riding in a cold wind. Aconite, belladonna, hepacel, trustox, all the above. So I think it's definitely all the above. And unconscious, stupid, answers slowly when questioned. A picture of acute idiocy. It looks like bacteria, but since this word is there, acute idiocy, always remember it is helleborus. Okay, Baryta is chronic and helleborus is acute idiocy. Okay, and I think that's it. Okay, thank you.